Portia, and I'm here to bring news about the upcoming 2020 election live from the Albany Nursing Building in New Brunswick, New Jersey. Here are the candidates and their respective parties. Donald Trump for the Republican Party, Joe Biden representing the Democratic Party, Howie Hawkins for the Green Party, and Joe Jorgensen representing the Libertarian Party. Before we hear from our candidates, here's a message from our sponsor.
Hello, School of Nursing students. My name is Dr. Kyle Warren, and I am the Vice Dean of the Rutgers University School of Nursing. I come to you today to discuss the importance of voting. Choosing to vote is a choice to utilize your voice. It is your right, and it is your responsibility. As I reflect on why voting is so important to me, I am reminded of times during which voting was not a right for individuals such as myself. In fact, I am reminded that I was raised by a grandmother whom, if she were born just a few years earlier, would have been born into a country in which she could not vote simply because of her gender. You have chosen a profession that requires you to advocate for yourself and to advocate for others particularly during their most vulnerable times. What a noble calling. One way to begin that advocacy is to lend your voice and to exercise your right to vote. No matter the candidate you choose, stand up and be counted.
Thank you, Dean Warren, for those inspiring words. Now, let's head inside to meet the candidates. Our first topic is Medicare for All. We will start off with President Trump from the Republican Party. What are your thoughts?
I'm seeking to overturn the Affordable Care Act because it is hurting American families, farmers, and small businesses with skyrocketing health insurance costs. On top of that, Medicare for All is harmful to senior citizens. Medicare for All would lead to rationing, put hospitals out of business, and cause seniors to lose control of their health care. Let me tell you, I am an ally of senior citizens, and what hurts them would hurt me. Therefore, we need to improve the system and allow Medicare enrollees to opt into private, qualified plans.
Well, I have to disagree with you there, Donald. We need to protect and build upon Obama's Affordable Care Act. Our focus should be on serving the minority who are still uninsured. I vowed to cover all individuals who make below 138% of the federal poverty level. How, you may ask? My team and I will automatically enroll these individuals when they interact with certain institutions, such as public schools.
Mr. Hawkins, what are your thoughts on this matter?
The Green Party supports single-payer universal health care and preventative care for all. Healthcare is a right, not a privilege. Joe, I know you said that you wanted to protect the Affordable Care Act, but I do have one concern. Obama was primarily focused on selling his law and more insurance to the public. What he didn't say is that people with health insurance in the U.S. still can't afford the care they need. We need to implement free health care for all, regardless of socioeconomic status.
And lastly, Ms. Jorgensen, please tell us your perspective about this issue.
Well, we favor restoring and reviving a free market healthcare system. We recognize the freedom of individuals to determine the level of healthcare and health insurance, the care providers they want, the medicines and treatment they will use, and all other aspects of their medical care, including end-of-life decisions.
Our second topic is reproductive rights. This has been a heavily debated topic for several decades. Starting with you, President Trump, what is your stance on this issue?
I believe in pro-life. During my time in office, I signed an executive order reinstating the Mexico City policy, which aims to end abortion funding abroad. I also believe that the abortion aspect of Planned Parenthood should absolutely be defunded. Because I am pro-life, I promise to appoint pro-life judges who will overturn Roe v. Wade. I will also let states determine their position regarding abortion laws.
Mr. Biden, I've noticed over the years that you have flip-flopped your opinion on abortion. What is your position on the topic now?
I'm pro-choice. Unlike Donald here, I believe Planned Parenthood must be funded. States cannot refuse Medicaid funding for Planned Parenthood. Because I'm pro-choice, when I am in office, I plan to repeal the Mexico City policy that was too hastily reinstated.
I believe that it is essential that the option of a safe, legal abortion remains available to individuals everywhere. Contraception and abortion should be included in all U.S. health insurance policies, and if one does not have the means to pay for these services, it is imperative that the state government must be responsible and legally offer free services to poverty-stricken individuals.
Myself and the Libertarian Party strongly uphold the notion of pro-choice. There should not be any legal restrictions on abortion for any reason, by any method, or at any stage of gestation.
Mr. Trump, in October 2017, I noticed that you declared the opioid crisis a public health emergency. What is your plan to combat this issue?
We created a 3-part plan, including reducing demand and overprescription of opioids, eradicate the international and domestic drug supply chains which provide Americans illicit drugs, aid those struggling with addiction through treatment and recovery support services. However, prescription drugs are an important part to this nation's economy and well-being. Because it plays a key factor in our booming economy, we need to allow for drug importation, especially from Canada.
What about you, Mr. Biden? What are your plans and thoughts on this issue?
I plan to make a federal investment in prevention, treatment, and recovery services to all affected by drug dependence and mental health services. People will have access to high-quality healthcare, which include substance use disorder treatment and mental health services via Obamacare. Holding pharmaceutical companies accountable for profiting off of the opioid crisis is one step to combating this issue. It is also extremely important to bring reform to the criminal justice system to make sure people are not incarcerated solely for drug use.
To add on to what Joe said, drug abuse is not a criminal problem. It is a health problem. Criminalizing opioids contributes to the carnage of fatal overdoses. Addicts need help, not incarceration. Drug abuse treatment should be readily available to those who are seeking help. Also, I strongly believe that the government should regulate prices, especially life-saving drugs, such as legalizing marijuana.
I agree with Howie. We think the war on drugs is an ineffective way to frame and talk about the issue of substance abuse. Millions of nonviolent people have been imprisoned for nonviolent drug offenses. This money would be better spent rehabilitating violent offenders. We believe that the government should not be dictating people's drug intake, whether it be alcohol, marijuana, or tobacco.
This is an unprecedented time for everyone. What are your plans to return everything back to normal?
I have set up strict travel restrictions between foreign countries such as China and Europe. To moderate the numbers, my administration has distributed more than 1 million tests nationwide. We've been gradually opening up restaurants and other locations through outdoor dining, reinforcing social distancing guidelines, and wearing protective face gear and masks. We have the best economy in the world, and we will not let the coronavirus stop this great booming country.
Donald, I understand that we need to get the economy up and running again. However, should it be at the cost of countless lives? We need to spend the necessary funds to meet public health needs. We must listen to scientists and public health leaders and give all frontline workers high quality and appropriate personal protective equipment. We need to respect one another and keep each other safe because we are fighting this virus together.
The Green Party is opposed to this premature reopening. Instead, we should follow the science-based recommendations of public health experts at the CDC. Infections and deaths are still increasing, and we must prepare for the likelihood that this health crisis will be with us for years.
Well, I have to disagree with you there, Howie. It's tragic that the U.S. government has put all of us under house arrest, and tens of millions of people have lost their jobs because of it. Although it would be considered wise to stay home amid a pandemic, the government should not mandate it. Rather, it should be the individual's choice to go about their lives as they choose.
And that's a wrap. Thank you all for tuning in. Remember to vote. Register to vote if you haven't already. You can go to vote.gov to find out how to register to vote in your state.
I'm Dean Warren, and I approve this message.